So, hi, DeDe. Welcome to our conversation. I want to first of all thank you for being an amazing patient, following the outlines and recommendations that we've made, and doing all the work at home that you've been asked to do. And when you came to our office, what was going on?
So I had vertigo, and I had been to get treatment from Balance in Chicago, and it went away, but then it came back, and I was looking on YouTube for things to help with vertigo, and I found your video, and I'm a big fan of chiropractic care, so I saw that you specialize in treating people. I think you do. I saw a clip where you were helping people with vertigo, overcome vertigo.
Awesome. And what was your experience when you first came to the office like, compared to maybe even other chiropractors that you've been to?
Well, it was your style of seeing patients was interesting. Beside the fact that I love the staff, everybody's always friendly and in a good mood. But I wasn't used to having an open patient room setting where all the tables are out in the open. But what I love about it is it's quick and efficient because everybody has a lot to do. So you get in and you never sit down in a waiting room. You automatically are moving toward doing your own exercises, getting your adjustment, and then doing your traction or whatever treatments you have set up for. So there's never really a wait time, which I really appreciate.
That's part of what we shoot for, but we do know emergencies happen. And in your other care that you've gotten as it's related to vertigo or even chiropractic care, have you had to wait in the past?
I have, and I've never really had anybody take my x-ray and look at it and go over it with me. But part of it was probably I didn't want to take an x-ray because I'm always in a hurry. Let's just do the adjustment. I'll be okay. So it was nice that we had the x-ray. We talked about a plan of treatment, and that you keep looking back and you keep looking at my progress. So that's nice to see that things are better. And what I haven't told you is that my sleep apnea is gone.
What?
I wouldn't even, that's not even why I was there, but it's been about 3 or 4 weeks and I haven't slept with a CPAP machine. I've been able to sleep on my back. I haven't had a single episode.
That's absolutely amazing. Now, the process that we wind up using, the CBP postural biomechanics, how did that differ from some of the other treatments that you've received for vertigo and or for chiropractic care that you've received in the past?
I guess the main thing was traction, and I've never done exercises to warm up the neck like we do when I first get there. So that's different.
And what would you say to someone who is looking for help with their management of their vertigo? What do you think they should do?
I just in general, I think different methods work differently for different people. And I went down a road where I sought treatment in 3 places. One was downtown Chicago with that Balance. They specialize in 60% of their patients to have vertigo. And while that worked, it didn't stick. And then I also tried to go to an audiologist that my stepfather goes to out here, and that didn't work. So I do think, I guess I would say it's not a quick fix most of the time. In his case, he went one time or twice and it was done, but not everybody operates that way. So sometimes it's going to take effort and commitment on your part and a continuation of doing those things to improve it, to keep it at bay, I guess is what I'm saying.
I guess I should ask, has your vertigos over the 8 months wound up showing back up again?
It did one time when I told you, but I don't know that. Okay, so it wasn't a crystal situation. It was more that the dizziness I was having a hard time getting over the dizziness, but I'm over the dizziness now. The only small little residue that I have left is that if I turn really quickly, I don't necessarily get dizzy. It's more of a balance thing that I just constantly have. I probably just have to slow down and get used to being over it. I guess our bodies have memories. I know that. So get used to not being dizzy. Anyway, but my dizziness was when I was laying down and I would flip over, and that's gone.
Very cool. And would you say that the things you've asked you to do were hard?
No, they're not hard. And they're not really even, they don't really even take that long. It's just a matter of adding it to the schedule, which I did last night. I brought it with me.
What would you, anything else that you'd want to say to anyone else who had concerns about their health or their spine?
I think the one thing that you said, what's your goal for your health? And I said to be in minimal pain. And you said, why would you want any pain? And so I guess that to make it a practice in your life is to keep your spine healthy, since everything's connected, which involves getting regular adjustments. And I guess also I don't want to, have the, as I'm getting older, because I know you have younger clients too, osteoporosis. So if I can do anything to prevent that, because I'm a big fan of posture and, the way you carry yourself, it's important to me not to have pains, and it's all related, but also just to have good posture is important because it affects how we feel. So that's helpful.
Awesome. Well, DeDe, I want to thank you for joining me and sharing with me your story. Your story is going to help a ton of other people to wind up being able to take action and see what their health future can look like, because your future is bright.
Thank you for your time. Be
You're
safe.
welcome. Oh, thank you for your time.
You're welcome.